It's definitely not a new problem. It's something that existed for years.
A problem that has been compounded by neglect, stigma, and a lack of resources, largely due to the pandemic in the last 2 years, has reached a deadly crisis point in Manitoba. And now, for the first time in the province's history, advocates say a potential solution to the overdose crisis is on the horizon.
We're ready to go. I think we have the organizations, we've had these conversations, we've had these initial planning steps taken in the community, and so now it's about someone stepping up, providing the funds, and then government providing the permissions to allow us to do it legally.
Conversations around supervised consumption and harm reduction have been loud and long-standing in grassroots organizations for years in Winnipeg, and now that conversation is happening at City Hall. A recent city staff report indicating there is evidence and need for a safe consumption site in Winnipeg. Jamil Mahmood with the Main Street Project would like to see an Indigenous-led harm reduction site and says that Main Street Project is ready to step up and host a site if called upon.
For Winnipeg, it makes sense to have kind of a multiple site model, so probably multiple agencies running their own sites in partnership. And so I think that's one of the great things about Winnipeg. Not-for-profits have always worked together, and we will always continue to work together.
He says through local consultation, work is already underway to identify which agencies in which neighborhoods are best suited to offer services.
We care about people. We don't want them to be safe, and just like anything else, if it was food, if it was anything else, we wouldn't allow folks to just take poison, and yet when it comes to substances, we do, and so we need to change that attitude to that.
Manitoba is falling behind when it comes to supervised consumption. Manitoba is the only Western Canadian province without a site. In the summer, Health Minister Audrey Gordon was asked about supervised consumption talks happening in Winnipeg. While she would not answer directly if her government would support a supervised consumption site in the city, she did say her government takes harm reduction and addiction seriously.
Our government is committed to ensuring that individuals get the care they need who are struggling with the challenges of overdoses, mental health, and addictions. That's why we created this new Ministry of Mental Health, Wellness, and Recovery, so that we could have a focus on addressing this issue.
Gordon pointed to a 2018 report the government has used to gauge where the system needs improvement.
We've launched over 30 new initiatives. We continue to speak with stakeholders, providing services in the community around overdoses and addiction supports, and we'll continue to work with them going forward.
The 2018 report showed roughly 100 people who accessed sterile injection supplies at Street Connections, one of the province's only harm reduction service providers, found increased access to harm reduction supplies was, quote, the most valued service needed, end quote, followed by, quote, supervised consumption and increased access to addiction services, end quote. And for people like Mahmood, he says it appears that there's a new openness that has continued to grow with the departure of Brian Pallister as Premier.
I think the temperature's changing, and I think we're getting a new response, and we're pretty excited about it. I think our hope is now that action comes.
The provincial government is expected to deliver its 5-year action plan before 2021 is over that will focus on a coordinated provincial system for prevention, treatment, and recovery. Before the year is out, we may learn more about the possibility of supervised consumption in Manitoba. In Winnipeg, Morgan Majeski, City News.